So the little trick that they've done here is they have issued two separate letters for two separate vaccines. The Pfizer vaccine, which is what is currently available, is still under emergency use authorization, and it still has the liability shield. The once again, the mainstream media has lied to you. I'm sorry to say that. I know it's a shock to this readership. But the product that's licensed is the BioNTech product, which is substantially similar, but not necessarily identical. It's called Comirnaty. I think that's how it's pronounced. And it's not yet available. They haven't started manufacturing it or labeling it. And that's the one that the liability waiver will no longer apply to. So the one that's actually licensed is not yet available. And when it does become available, it will no longer have the liability shield. In the interim, the one that does have the liability shield is the Pfizer product, and that's what's currently available, and it's still under emergency use authorization. So that's no change.
Okay.
The press has just not done their work and figured out what's actually
Yeah.
going on here.
Fine, but that's where we have geniuses like you. I just want to make sure something's clear to the audience. And we're trying to be fair to the FDA in this whole process, this CCP virus. The emergency use authorization, as it currently stands by the FDA for Pfizer, does not allow its use for children under 16. Is that correct?
Correct.
Okay. The overall blanket approval for the other one, for BioNTech or whatever it's called, the one that's not fully done yet, does that include, is the way you read it, that does not include a full FDA authorization until at least 2023 or 2024 when these other studies are completed, correct?
That's the way I read it. That seems to be the way it's written. And by the way, in terms of the timelines, I just wanted to go back to that. There's a statement that the BLA acknowledges, so that's the license for the BioNTech product. Here's the language. The BLA acknowledges long-term myocardial issues with a 5-year follow-up, which is consistent with the lower range of long-term follow-up for gene therapy products. It appears that banging on them that they haven't applied the gene therapy checklist may have succeeded, and they appear to now, without acknowledging it, starting to apply the requirements that are applied for gene therapy products. But in terms of the cardiac issues, they acknowledge that the myocardial issues will require a 5-year follow-up.
But once this is in place, can the FDA would then have to come back and issue an emergency use authorization for the second one for children, correct? That's clearly not done right now. Is that correct?
I would imagine that what they will do is an emergency use authorization for the pediatric population for Pfizer. So that will keep Pfizer indemnified, because that's something that Pfizer has been seeking in all of their worldwide contracts with other governments, is full indemnification. They will not sell you vaccine unless you waive liability if you're a government, head of state or whatever. So that's the Pfizer position, is we don't want to own the liability here. And, you know, that raises the question, what is it they're so scared about? If these are fully safe vaccines, why does Pfizer believe that it has to have liability protection?
Let's keep Singapore healthy. For your own safety and for those around you, please stand at least 1 meter apart. Thank you.
We started out using Spot in a variety of hazardous environments like refineries and electric power plants. But now that this pandemic is on, people realize that there's lots of situations where you'd rather not have human contact, and so the robots come in there and been a useful tool.
Those around you, please stand at least 1 meter apart. Thank you.
In the small town of Westport, Connecticut, a drone is scanning for COVID-19 symptoms. And the reaction here is, well, mixed. Police have been flying drones here since 2016 for everything from traffic management to search and rescue. And they can use them to spot and warn people who are gathered too closely. But now, Dragonfly, the company that makes the drones, claims they can also detect whether you're running a fever, sneezing, or coughing heavily, all through a single camera flying 40 feet overhead.
Subtle differences are on like a millimeter type of basis. So if somebody's coughing, like this or like this, it's actually quite a different type of cough actually that they're detecting.
The police chief says this partnership could help the town reopen, and they need every tool possible.
In a pandemic, we'll see the elevated temperatures, we'll see the increase in blood pressure, we'll see the flushed skin. So to have the technology available for future incidents, whether it be COVID related or something else that comes our way, I think we need to prepare for that.
This is the first time Americans have been scanned for symptoms in this way, and there are skeptics.
I don't know that this technology could distinguish between somebody with COVID-19 and somebody with influenza. I'm inclined to doubt it.
Not to mention that many infected people never exhibit obvious symptoms. And even if it does work, are we ready to be scanned from the air?
The involvement of the police makes me more worried about how this technology might have what we sometimes call function creep, in that it is used and designed for one purpose, but then it gets repurposed for other things.
Digital contact tracing has the phone send out Bluetooth radio pings constantly, keeping a record of all the other phones that also have this service turned on that were near you in the past 2 weeks. So all those random people you may have interacted with, but you don't know who they are to even warn them, well, they can get a warning if the time comes that you get sick. They can get alerted that they may have been near a sick person while the system never tells them who the sick person was. Apple and Google are working on ways for this to work seamlessly across iPhones and Android phones. They even came up with a little graphic to help explain it. Alice and Bob meet and talk for 10 minutes. Their phones are exchanging little anonymous pings, and the phones keep a record of it on the device. Oh no, Bob is sick. He tests positive for COVID-19. He downloads an app from a public health authority, and the app requires a doctor to indicate that he indeed has tested positive for COVID-19. With Bob's permission, because this is all in Bob's power, he sends a warning to any phone he came in contact with over the past 14 days. Meanwhile, Alice is just chilling at home days later when she sees the phone alert. Someone she was near recently has tested positive for COVID-19. It doesn't say it was Bob, but maybe she's now wondering who she hung out with recently. And now Alice gets advice on what to do next. Maybe that's to get tested or to isolate from others. Hopefully Alice can test to see if she really is sick and can avoid hanging out with other people in the meantime.
Anthony Karam knows he is COVID positive when he steps into this public lift. Already breaking so many rules, he doesn't bother to cover his mouth as he sneezes and splutters. The 27-year-old is still infectious, but has gone missing from his Wentworth Point apartment. A warrant now issued for his arrest.
This 27-year-old chap, who apparently has expressed the view that he doesn't care less whether he spreads the virus, is one example of the worst of the worst.
There's little sympathy for anyone ignoring the health orders, even this group of teenagers caught partying after dark at the bottom of the North Bondi Cliffs. Herded to higher ground by Polaire's spotlight and speaker, the 8 boys were placed in handcuffs and left to explain a $1,000 fine to Mum.
681 penalty infringement notices issued in the last 24 hours. More than 400 of those notices were again for people being outside of their home without a reasonable excuse.
Sideline Sharks player Josh Dugan denies lying to police when he was found a long way from Sydney. The 31-year-old stopped at 11:30 last night in Lithgow, where he allegedly told officers he was moving to the area and feeding animals before admitting to visiting a friend. He and a passenger turned back to Sydney, only to be pulled over a second time, travelling in the wrong direction. The NRL is investigating and criminal charges could be laid. It's getting harder and harder to hide if you're doing the wrong thing, especially in the construction industry, a crackdown following on from the recent shutdown. Workers sent home if their paperwork isn't in check.
It is a struggle, but it's it's just what has to be done. Like, nobody likes telling people to go home. They've all got families to feed.
Our cameras rolling on another random blitz in Marsden Park.
Authorising me under the Public Health Act.
Inspectors have asked these tradesmen to show proof of their QR check-in as well as identification and vaccination records. One of the men here is from Campsie and he doesn't have his documentation, so he's being sent home. He may lose a chunk of his pay too if officers follow through with a fine.
Where you're so engrossed in it, and it's really hard to watch people die. You don't want that.
Right.
You have to look at things well, and what are we doing as healthcare workers? Are we encouraging our patients and educating well to, tell them, let's eat well, let's exercise. Instead, we're going fast, giving medications, running to the next thing, and running mindlessly. We're not truly caring for our patients and taking that time to help them to understand. So, a lot of it, and so you see that heartbreak of them passing away,
Yeah.
And then you're concerned, and they don't know about, the vaccination, and I knew right away I would wait to see what the adverse reactions are. You can look at the VAERS, like vaccine adverse side effects, and just see. For 2021 alone, there's hundreds of thousands of reactions. You weed through well, get past the points of like my arm hurts, and you see serious reactions. And then you hear about these medical doctors that are seeing serious cases in their offices of skin diseases, cancers coming back. So it's going past the point of, their CEOs, chief medical officers saying look at all these people. 97% of the patients are unvaccinated. Okay, yeah, that's true, but is your ICU only 12 beds? So maybe that's 9, 10 patients. And so thinking through clearly and just being like, okay, what else can I do? Besides the vaccination, what else can I do to care well for my patients?
Right.
So, does that help?
Yeah. Well, and are you actually a healthcare worker?
I am, yes.
And so do you have a nursing degree then? And
yes,
so
I'm a registered nurse. I'm actually a certified wound ostomy continence nurse. So I get the blessing to be able to assess a lot of wounds. So a lot of diabetic ulcers. And so, asking them, what are you eating? What are you, how can you exercise well? So that's a real important to kind of help patients and help wounds heal. If your nutrition's poor, you're not going to heal.
Right.
So that's...
Yeah. What do you say? So there's all these people I see online, for example. I see a lot of comments online through social network about how, all the unvaccinated people are to blame. For example, people in Israel, I'm finding out that Israel is kind of being seen as like this sort of testing ground for all this, right? And like a pretty high portion of Israel's population is vaccinated, yet they're still seeing pretty high rates of COVID death among people who are vaccinated, but they're still blaming people who are unvaccinated. So what do you say to people who would say, oh, well, there's people who are vaccinated who are dying, but it's still the fault of people who are unvaccinated because they're spreading, they're still, we have to reach a certain number of people who are vaccinated in order to what's the term that they use to flatten the curve.
Yes.
Yeah. So what would you say to that?
So, that's where we're still I'm going to still call it an investigational vaccine, and I still believe that. Even though they made Pfizer, approved, really, we don't know what it's doing. People are saying, oh, it messes with your DNA. I'm not 100% sure. There's good doctors like Dr. Ryan Poland up in Idaho, and he's explained a lot very well that's helped me understand. But there's something going on that it's messing with. He explained the T helper cells. So people can't, when they got the vaccination, they're seeing that they can't fight infections well. So yeah, maybe they're getting it from unvaccinated, and then now how the CDC has been saying how you can still spread it if you're vaccinated. So the vaccinated are all ones hanging out together because they're the ones that are like, I don't want to be with unvaccinated people. So, but they're still spreading it probably to each other. So, that's, Israel did a great job vaccinating, and I appreciate that, and I appreciate the people that took that stance to try to see if it helped, but clearly we're seeing it's not helping. And so, I made that decision to wait, and so you have that choice. It's a personal preference, and that's where it needs to be for this vaccination.
Okay. So are you also opposed to all of the, the push for vaccine passports and, making it mandatory for people to be vaccinated who are flying from state to state or country to country and that sort of thing?
Then we need passport vaccinations for colds and the influenza.
Right. Yeah.
And, there's other things.
Just kind of pushing the door open for more tyranny.
It's just silly.
Yeah.
I mean, as healthcare workers, we need to be teaching the population. I remember in nursing school, it was Healthy 2020. Teaching people we were going to go more to the public sector, get away from hospitals, make the hospital smaller. Well, look at now. They want to make them bigger and to treat more people and all this stuff. And so it's like, wait, what? So that's where, the passport vaccine, having that, it's just, pushing people more to segregation, more to just, and it's, you know, I'm sorry to say this, but okay, if you have a vaccine passport, why can't you have a voter ID card? Like,
right.
That's just totally illogical right now. If they're going to force for that, then I'm going to say then force
Sure.
for voter ID.
Yeah.
So,
yeah,
it doesn't make any sense.
That is made from the 4th generation stem cell line of aborted fetal cells, then you need to have that inside your exemption. If you want to take a picture of this, come see me, and that way you can include the language in your exemption. People are getting some of these approved, so this will only help in that battle to get it approved. Like I said, my name is Brian Mache. I'm running for governor of Arizona in 2022. My petition is right here. No more elitists. We need to send one of us, a nurse to the Capitol, someone that will look out for our best interests. Thank you.